Hi, everyone, and welcome to all of our viewers. Thank you all so much for joining us today for this live webinar. My name is Nama. I'm a clinical manager here at Alma. And as always, I'm so excited and so happy to be part of this live session. And today we'll be discussing the Alma PrimeX, our newest premium body contouring device. We launched the Alma PrimeX in April this year, and we're still feeling the buzz and the excitement of it all. And today we are hosting 3 of the top doctors in the field and the 3 doctors who have been part of this project from the very start. Each doctor will give a short presentation on their experience with this platform. And afterwards we'll have all the 3 doctors here for a live Q&A session. So if you have any questions, please feel free to submit them in the chat and we'll hopefully be able to answer them all later on. Let's start off with Dr. Ines Werner, a renowned dermatologist and expert in the field. We've had the privilege of working with Dr. Werner for many years and value her expertise and experience. Dr. Werner started working with the Alma PrimeX during the height of COVID-19 here in Israel. And as you can imagine, that brought about many challenges for all. And Dr. Werner will share how COVID generated the need and want for these treatments more so than ever, and discuss how our patients feel about the treatments and about the results. So let's hear from Dr. Werner.
Hello, good afternoon. I'm going to share with you today my experience with the Alma PrimeX technology, and I'm really honored to be here and to actually share my experience. So let me share my screen. So the Alma PrimeX actually has been in our clinic for a while. We've been using it for quite a long time, for more than a year in the clinic. And I'm so happy to share my experience with you, as it's been really great. So we've been using it for over a year now. And we've been using the Alma PrimeX during the COVID-19 pandemic, and many patients came actually stressed about their body because they gained weight and they were really stressed, and we were really excited to be able to offer them this very innovative treatment for body contouring. So the Alma PrimeX system actually has 3 heads. The first handpiece is the ultrawave, and maybe this is the most important handpiece and the most innovative handpiece in the system, and we'll talk about this a little bit later. The other 2 handpieces are radio frequency handpieces. One is the unibody and the other one is the accentuate, and also I will show you the protocols that are there to combine the handpieces, but also the protocol that only uses the ultrawave. And also in this protocol, we actually did the clinical study, which was actually published just recently in dermatologic therapy. So what would be the mechanism of action of this technology? And you know that radio frequency will actually lead to even more tightening to tighten the tissue, but the ultrasound mechanism of action is actually very interesting, because in this case, because the ultrasound frequency is actually quite low relatively to other used frequencies in the medical field, most of the effect will be mechanical. So it's mostly a mechanical tissue effect, but also there is some thermal effect. And this mechanical effect will actually damage the adipocyte membrane. So it breaks down the adipocyte membrane due to a mechanical action. So these waves, they break the membrane, and this leads to lipid leakage and to reduction in cell volume. And actually, these cells actually are destroyed over time. And so there is a reduction in adipose tissue volume. And interestingly, what we see is that these results are long-term. So this damage actually has a very long-term efficacy on the tissue. And also this is something that we saw in our studies, that even 3 months after, we still had a very good tissue effect, clinical effect. Now, the new applicator is actually the most interesting part in the story, and because it's really, really improved, it's different, it's effective, it's very easy to use. So, and these are actually the features. So the features of the new ultrawave handpiece are the impulse, and the impulse actually delivers the ultrasound in pulses. So there are shock waves, and these shock waves give us a better mechanical effect on tissue. The other feature is maximize. Maximize is the vacuum, and you can imagine that because there is vacuum, there is a much better contact between the applicator and the skin, and so the efficacy of the waves is much better, and so you get a better clinical result. The other feature is the cone X. The cone X is actually this conical cavity here, which leads to ultrasound wave amplification, and so the efficacy is better, and there is no hotspot in the center of where the applicator touches the skin. And also there is automatic current control, which actually controls the ultrasound impedance, measures the ultrasound impedance, and so the energy is controlled. So here you can see the impulse. These are actually the pulses that ultrasound is delivered by, it delivers by pulses. And so there are minor shock waves which actually lead to cavitation, and so the treatment efficacy is better. And the good part of this is also that patients really like it, because it feels like a massage to the patient, and so not only it is more effective, but also it's very, very pleasant for the patient, which actually feels like there is a very warm, nice massage to the area that is treated. The other very important feature is the vacuum. That's the maximize. The maximize actually improves the contact, and also here I have to say patients like a lot the vacuum because they feel it's effective. They feel that there is something is happening in their tissue, there is some movement there, and there is, due to this vacuum, actually reduced loss of energy, and so the efficacy of the treatment is improved. The other is the cone X. I already told you about this. This is actually this cone here, which amplifies the acoustic waves. There is less reflection of these ultrasound waves and no central hotspot, and so there is also a better efficacy. And the last feature is actually this measurement of acoustic impedance, because you know that the acoustic impedance is different from patient to patient. And so the energy actually needs to be adjusted to each patient. And so we're always giving the right energy to each patient. Now, in our clinic, we were very happy, Werner Clinic, to be the first beta site to also evaluate the design of the applicator. And the applicator is really nice and really easy to use, and it's very ergonomic. And so the technician is actually also happy to do the treatment. And so, and that's really, really important with these treatments. It really needs some energy, and the connection of your technician with the patient. So it has to be pleasant. So because of this new ergonomic design, there are actually 3 ways to actually hold the applicator. You can hold it from the side, that's one way. You can also hold it just with one hand from above, that's the second way. And the third way is to have both hands and to actually do the treatment with both hands, which is also, for a person like me, who has, for instance, quite small hands, much easier to do. Another feature is the Alma Air Belt, which also makes the treatment a little bit more convenient. So the treatment is very convenient, both for the patient, but also for the technician. And also another very nice feature is the new and improved user interface, because the user interface has to be easy. When it's easy, the technician can just do it, and it's very simple, intuitive. The design is nice and easy for all technicians. So here you have the power, the time, the impulse cycles, impulse frequency, and the vacuum, and you control it. And it's really, really very straightforward, easy to do, easy to use, and the technicians are happy about that too. Now, the COVID-19 was actually, and we're still in it, you know, but it was not an easy time for the clinic because we had a few shutdowns. And now actually patients are coming back, but even during the pandemic, the really, you know, when we had the tough times of this pandemic, a lot of patients came, and they came because they were stressed, because they exercised less, because they ate more, and so they gained weight, and they had some low self-esteem. And so when we offered them the Alma PrimeX treatment, they were so happy to enter, to do the protocol, to do the treatment, and to really get some improvement in their body contour, in their well-being, and really how they felt about themselves. So I'll show you now the protocols that are used, that we've been using. And this is the protocol. Actually, the classic protocol is the protocol that we have been using most in the clinic. This is also the protocol by which we did the study that was published in Dermatologic Therapy just recently. So this protocol is very easy. It's a 20-minute treatment. You do it 4 times with an interval of 1 week between treatments. And in the study, we also followed up the patients for 12 weeks after finishing the protocol. You reached 42 degrees on the skin, so it's quite pleasant, it's not painful, and patients really like it. The second protocol is PrimeX Pro protocol. In this protocol, actually, you combine the ultrawave handpiece for 20 minutes once a week with another handpiece, with the radiofrequency handpiece, the Accentuate handpiece, which is a hands-free handpiece that is kept for 20 minutes on the area. And this addition of the radio frequency actually leads to better skin tightening, because it can actually hit the dermis, and so in this way there will be a little bit more skin tightening in the area. So it will also be better for patients who not only need fat reduction but also some tightening of the tissue. And you can use it on the abdomen, you can use it on the flanks, on the inner thighs, and also on the outer thighs. And this is just an example. This is an abdomen, how it is heated, and the lighter it is, the higher the temperature. Here it will be around 42 degrees, which is very good, and this will actually give us much better skin tightening after the treatment. The third protocol is the PrimeX Premium protocol. In this protocol, we use the ultrawave, this time for 30 minutes. And after finishing the ultrawave treatment, we treat the patient with a radiofrequency handpiece that's called Unibody for 10 minutes. And we heat the skin in this with this handpiece to 40 to 42 degrees. And here we actually, the treatment is longer, but we have less treatment. So only 3 treatments are needed to achieve similar results. So this is also a very nice protocol for people who need also some extra skin tightening together with circumference reduction. And on the other hand, it has just 3 treatments. And this is the study that we actually published recently in Dermatologic Therapy. You can see it or get it or receive it from the Alma team. It's a novel non-focused pulsed ultrasound technology for non-invasive circumference reduction. And as you know, these are, of course, guided transverse waves of the ultrasound. And we've been using, we actually treated 18 healthy women with BMI under 25. They were treated with the classic protocol, as I told you, 4 treatments of 20 minutes for the abdominal region at 1 week interval. And the efficacy was evaluated 1 week after finishing the 4 treatments, but also 12 weeks after the treatment. So we also measured the long-term effect of this treatment. And subjects also rated their satisfaction, and safety was naturally evaluated also during this protocol. So what we saw is that 1 week after the final session, we had a 5.4 centimeters mean reduction of 5.4 centimeters. And in 3 months, nearly all the results were actually kept because we had 5.2 centimeters mean circumference reduction of the abdomen. So this is very, very nice because the results were actually fast. So we had fast results, but also they stayed for long term, and patients were very satisfied. So most of the patients were either satisfied or very satisfied, and there were no dramatic weight fluctuations during this protocol. Now here you can see it in the table. Actually, you can see it or in a graph more that actually there is a very nice circumference reduction after finishing the 4 treatments, and that this reduction actually is kept also 3 months after finishing the protocol. And these are some before and after. This is 1 month after 4 treatments, and this is a huge reduction of -7, -9, -8. So many patients had really fantastic results. I have to say, we were
아이에게 적용하는 울트라웨이브
Sorry, just having a quick technical difficulty. We'll get the Ines, Dr. Werner's session back to you in a few minutes. In the meantime, when we finish with Dr. Werner's session, we'll move on to our next doctor, which is Dr. Fernando Urdiales, who is another expert that we have worked with on this project. Dr. Urdiales, he'll introduce himself, but just some info on him. He's from Malaga, Spain, and has been practicing aesthetic medicine for over 32 years, specializing in all energy-based devices and has
body
been
contouring.
Okay, I'll let Dr. Ines Werner finish, and then we'll carry on with Dr. Fernando Urdiales.
The advanced ultrasound applicator, the UltraWave, as I explained to you, together with the 2 radiofrequency applicators, the Unibody and the Accentuate, offer effective treatment, easy to use, very pleasant to the patient, versatile, and can be adjusted to the specific patient's needs. And thank you very much for your attention. Thank you, and see you hopefully live very soon. See you.
Thank you so much, Dr. Werner. I actually had the pleasure of working a lot with Dr. Werner on this project, and I learned so much from her and her clinic, and so much about the treatments from this better side. So it really, really was a pleasure. As I said, we'll move on to Dr. Fernando Urdiales, which, as I said before, another expert that has worked on this project with us. As I said, he's from Malaga, Spain, has extensive experience in the energy-based device world in general, and specifically in radio frequency and ultrasound platforms. He has actually used our Alma's first generations of radio frequency and ultrasound platforms, and has had a lot of influence on the development and the evolution of these platforms to what they are today because of his experience. He also has a lot of experience with other body contouring platforms, contouring in general. And in this session, part of his session will focus on how to combine between the different treatments, and we'll hear from his expertise. So thank you for joining us, Dr. Urdiales, and you're welcome to share your screen, and we're excited to hear you.
Dr. Urdiales, can you please unmute yourself?
Okay.
And you can share your screen. Thank you so much.
Okay. Good morning, everybody. In Spain this morning. I'm very proud to participate in the new study of accent. Since we are studying accent with Alma since 2003, I'm very proud of that. Okay, then the accent family is, and I'm very proud of our participation since 2003 in the development of this technology. Actually, radio frequency is a technique that we use in the clinic, and we think that this is the best platform of radio frequency and ultrasound in the market. And it's very important to know the electrode configuration in this kind of technologies. And the most important thing is the phase shifter that it was developed since many years ago, and it depends the action of the radio frequency in the thickness of the tissue. Accent Prime offers the same parameters that we had with Accent Prime before with radio frequency, but the newest is to apply a new ultrasonic intensity and a new ultrasonic probe in this technology that offers much more higher energies to treat local objects. Prime is continue with the cold mode of the action of the ultrasounds, and we continue using this technology with the cold mode. Think about that the effect of the radio frequency is to increase the temperature in the tissue and the production of headshot protein 47 that at the end offers to produce a new collagen. But the ultrasounds produce always cavitation, and cavitation destroy and reduce the fat cells with this. Think about that the area of action of the new ultrasounds in this Accent Prime X is same than before, but you can have a vacuum area to apply much more better the ultrasound over the tip. Energy is higher. In the study that I will present now, we use this body analyzer to see in all the patients, and we use echography and ultrasounds as well to do a measurement of the fat tissue in all the abdominal area. Then this is the preliminary clinical results that we obtained in 20 patients. And the Prime X study patient selection and dosimetry was done in 20 patients, 4 men and 16 women, in 4 sessions, weekly session. We select non-obese people, and we did photos with 2 dimensions and 3 dimensions with Canfil Vectra, and we did echography in all the patients after and before the treatment in the abdominal area. Think about that 5 patients with the study about COVID reasons. Then we use at the abdominal area always radiofrequency and ultrasounds, and we use only ultrasounds in the tights area. And we did the after treatment. Have a look at this case. That is the case number 7. This is a man with this treatment that we treat, for example, in the abdominal area and the hips area as well. And this guy has a very good result because supraumbilical adipose tissue reduced 0.33 centimeters in 4 sessions only, and infraumbilical adipose tissue was reduced in 1 centimeter. The right hip was 1.19 centimeters and the left hip was 0.78 centimeters. Okay, this is a photos of after and before, and you see that you have less volume in the area, much less volume in the area, much less volume in the area, and the skin tightening is evident in the area because we obtain skin tightening about collagen synthesis. All the cases. You can see the 3D images that we obtained with and these are the right lateral. This is a 45 degree and left area. And this is very interesting to see the reduction in the area when the patient is live, but we obtain these images with Vectra as well. And you see in the caudal vision of the and Vectra is very useful to show the results because in the yellow areas you should have this volume, and we can do a measurement of the losing of volume in each area. So the yellow area indicates that the patient have lose some volume in the area that in this case is 444 centimeters cubic in this area. And you see the losing of the volume in this area. So this is the ultrasound measurements after and before in supraumbilical area and infraumbilical area. You see here the muscle that is evident, and this is supraumbilical, and this is the right area, the right hip, and this is the hip, and the final result of this patient, you see all the measurements here. Case that we obtain a very good result as well. This case is the same, after and before. It's a woman, it's a young woman. Think about that all the patient that has been selected, they are non-obese patient. In the lateral, you see in the lateral 45 degrees, the reduction and the skin tightening as well. And in the back area, you see the tights that has been. Then you see here the the 3D images as is very useful for measurement of the losing of volume areas. And you see the 45 then you see the lateral in the left, for example, and you see in the genital projection that you see, for example, the reduction of the abdominal area with this treatment that this is very evident in the photo, and in the caudal area that you see as well the reduction in the that is very evident, and in the yellow areas you see that the patient has to reduce a lot of volume. For example, in this case is 326.6 centimeter cubics in the and the patient feels that has lost a lot of volume in the area, and we can see, for example, the measurements that we did in the abdominal area, in supraumbilical and umbilical area, and in the right graphic images, we see a lot of collagen synthesis because we see a lot of fibrosis with these white images that we can see there. So it's very impressive that all patients have a lot of collagen synthesis and much more skin tightening skin and reducing volume of the thickness of fat. These are the results in all the study that we obtained in media of 0.97 centimeters in umbilical area and 0.89 centimeters in umbilical area. And in the hips, we obtained media of 1.01 centimeters in 4 sessions in the right hip and 0.52 centimeters in the left media of the patient. So, in our opinion, this technology allows body sculpting in all body's areas. They are not consumables. They are not effective in obese patients. The control of the phase shifter allows to go deeper with total control. The average of reduction of the thickness in the abdominal panicle in our study was 0.97 centimeters in infraumbilical area and 0.89 centimeters in supraumbilical area in 4 sessions only. Actually, we're doing much more sessions in the patients, but this study was done in 4 sessions only. And the average of reduction in the thickness of the hips tight area with only ultrasounds was 1.01 centimeter in the right thigh and 0.52 centimeters in the left thigh in 4 sessions. Normally, we're doing more sessions, and the sounds are much more better than the ultrasounds that we have with the Axin Prime that we have before. Then it has been observed fibrosis and skin tightening in all the areas. Degree of satisfaction in all the treatments in a scale from 0 to 5 was 4.88 in all the group treated, with the best results we obtain in people who are with the right weight, always in aesthetics, in a body sculpturing treatment. This is the same. In our experience, we noticed a big difference between Prime X and Prime with Prime Normal with the ultra wave clinical results. Ultra wave Prime X clinical results appear with fewer sessions than Prime. We are doing less sessions in the total treatment of the patient. And in our opinion, I think that actually we have a huge experience in body sculpturing system. It is the best body sculpturing system that you can find about. So it's a pleasure to present the results, and see you soon in the new event in Greece of Alma. Thank you very much for your attention. Bye-bye.
Thank you so much, Dr. Rudiales. I also learned so much from working with you on this project and from the data and all the information that you sent us. So thank you very, very much. And lastly, our Dr. Ko, from a very well-known dermatologist from Korea. And Dr. Ko was actually the first doctor to receive and work with this platform. She received the first prototype of the Alma PrimeX. And she started working on this project about almost over a year and a half ago in a clinic in South Korea, and was a real integral part of the development of the platform, the technology, and all the different protocols. As she'll tell you herself, but as there's an endless demand for body contouring treatments in the Asian market and the competition there is very fierce, Dr. Ko has invaluable experience in the field, and both with our products and with many other body contouring platforms. And she'll share this with you in the session today. So thank you, Dr. Ko.
안녕하세요. 아시아인에게 적용하는 울트라웨이브 기술에 대해서 오늘 말씀드릴 고정아 원장입니다. 저는 이 알마 본사를 비롯해서 체외 충격파인 스톨츠 그리고 바이어관츠를 비롯한 유수한 회사의 키닥터를 맡고 있는데요. 오늘 이 울트라웨이브에 대해서 소개를 해드릴 수 있어서 정말 영광입니다. 오늘 말씀드릴 순서는 제가 이제 한국, 특히 이제 아시아를 대표해서 한국에서 적용을 하는 이런 바디 컨투어링의 트렌드, 그리고 최근에 저희가 사용하고 있는 이제 악센트 프라임 그리고 울트라 웨이브에 대해서 말씀을 드리고요. 실제적으로 적용을 했을 때 느낀 점들, 그리고 좀 같은 프로토콜을 개발하기 위해서 어떤 점들이 필요한지에 대해서 함께 논의를 하고자 합니다. 바디 컨투어링 하면 역시 고주파인데요. 이 라디오 프리퀀시는 거의 역사적으로 알마와 함께 했다고 해도 과언이 아닐 것 같습니다. 알마에서 정말 좋은 이런 RF 장비들을 그동안 개발해 왔는데요. 저도 이런 장비들을 계속 사용을 해 왔습니다. 그런데 이제 이런 RF 장비들은 아주 좋지만 실제 타이트닝이 아니라 리폴라이시스를 위해서는 아주 많은 에너지를 효과적으로 안전하게 잘 전달해야 되기 때문에 좀 숙련된 스태프들이 필요하다라는 이런 필수적인 요소가 있었습니다. 그래서 고주파를 주로 쓰던 이런 이제 아시아의 이런 미용 의학 시점에 크라이오 리폴라이시스라는 장비들이 수년 전에 조금 더 유행처럼 일어났는데요. RF 크라이오 리폴라이시스 다음에 또 유행처럼 자리 잡았던 것이 바로 바디 하이프 장비인데요. 이런 하이프 장비의 장점이라면 한 번 시술에 조금 더 사이즈 감소를 많이 올 수 있다라는 거고요. 저도 최근까지도 사용을 해왔는데 사용을 하다 보니까 좀 여러 가지 단점들이 좀 보여서 최근에는 잘 사용을 하지 않는데요. 여러 가지 RF 크라이오 리폴라이시스, 그 다음에 바디 하이프를 거쳐서 최근에는 이런 셀렉티브한 부작용 없는 울트라 사운드가 조금 더 트렌드로 자리 잡고 있습니다. 최근에 이제 바디 시술에서의 어떤 새로운 트렌드 또는 새로운 요구도라고 하면 바로 컴플렉스하다, 즉 복잡 다단한 요구도를 한 번에 충족시켜 줘야 된다라는 점인데요. 그래서 이런 네 가지 요구도를 조금 더 심플하게 하나의 장비로 이룰 수 있다라고 나온 것이 이제 악센트 프라임이었는데요. 가장 최근에 이제 한국에서 좀 더 아시아에서 더 많이 요구도가 높아지고 있는 것이 바로 셀룰라이트인데요. 이런 셀룰라이트를 해결하기 위해서는 좀 더 컨비네이션을 하는 그런 여러 가지 프로토콜이 필요하게 되었습니다. 그래서 지방 감소시키기 전후에 이런 셀룰라이트가 있는 좀 단단한 부분의 살을 조금 더 흔들어주고, 즉 전 관리가 필요하고, 이렇게 흔들어서 부드러워진 상태에서 지방 감소를 한 후에 오늘 분해되는 이런 노폐물이나 지방들이 잘 배출되게까지 해주는 여러 가지 과정이 필요한데요. 이런 비만에 관련된, 특히 바디의 에스테틱 영역에 있어서 이런 시점에 울트라 웨이브가 나온 것은 정말 반가운 일인데요. 이 울트라 웨이브는 기존의 이제 비슷한 원리의 초음파, 울트라 스피드나 미니 스피드에 비해서 달라진 점이 있습니다. 바로 제가 좋아하는 이제 장점들이 추가가 됐는데요. 첫 번째로는 이 핸드피스 모양 자체에 변화가 생겼습니다. 가운데에 이렇게 비어있는 듯한 베큐민이 있는 할로우 레조네이터가 생긴 건데요. 이런 특성이 결과적으로는 이 초음파의 그 힘을, 파워를 조금 더 증폭시켜주는, 앰플리피케이션 시켜주는 효과가 있습니다. 두 번째 추가된 장점이 바로 제가 제일 좋아하는 부분인데요. 바로 풀싱 모드입니다. 마치 쇼크 웨이브처럼 파이브러스 티슈가 가득한 이런 셀룰라이트 있는 그런 지방층을 조금 더 때려주고 흔들어 줄 수 있는 기능이 추가된 건데요. 이 화면을 보시는 것처럼 이런 모드는 그냥 0으로 넣지 않을 수도 있고 10Hz 정도로 또는 20Hz 정도로 내가 원하는 비율로 조금 더 추가를 할 수 있습니다. 저는 이 가운데 10Hz 정도를 가장 좋아합니다. 그래서 어느 정도는 셀룰라이트도 흔들어주고, 그리고 동시에 초음파가 지방 세포를 좀 사멸시켜주고, 이 두 가지를 동시에 할 수 있다는 것이 바로 한 가지 핸드피스로 이제 두 가지 이상의 효과를 보는 장점이라고 할 수 있습니다. 우리가 보는 이제 비만 클리닉의 환자분들은 한 가지 문제만 가지고 오는 분이 드문데요. 주로 오른쪽에 보시는 것처럼 전체적으로는 사이즈 고민도 있지만 이렇게 이데마토스한 좀 부종을 함께 가지고 있는 파이브로 티슈를 가지고 있는 환자분들이 가장 많고요. 이런 두 가지 이런 유형의 셀룰라이트를 한 번에 해결할 수 있는 것이 바로 지방 감소와 함께 조금 더 셀룰라이트를 흔들어주는 풀싱 모드가 이제 역할을 할 수 있는 거죠. 저는 이제 쇼 웨이브 같은 이제 셀룰라이트 그리고 서큘레이션을 좋게 해주는 이제 부종 감소 이 두 가지를 위한 쇼 웨이브를 치료를 많이 해오고 있는데요. 그래서 최근에는 이런 에스테틱 메디슨에 있어서의 쇼 웨이브의 응용에 대한 책을 번역하기도 했습니다. 사실 전체적으로 이렇게 컨비네이션 해서 프로그램을 운영할 수도 있고 그런데 모두가 이렇게 복잡하게 치료를 할 수는 없기 때문에 이런 셀룰라이트 그리고 지방을 함께 조금 더 감소시킬 수 있는 방법으로 울트라웨이브를 선택을 해서 사용을 하고 있습니다. 이런 폴싱 모드와 같이 전체적으로 조금 더 쇼웨이브와 같은 에너지를 우리의 피부를 통해서 지방층까지 전달을 하면은 주로 이제 콜라겐들이 조금 더 치밀해지면서 조직이 좀 더 튼튼해지는 효과도 함께 가져올 수 있습니다. 또 하나 이제 울트라웨이브에 추가된 장점이 바로 백큐민인데요. 이 가운데 이런 할로우한 레조네이터 안쪽으로 해서 조금 더 백큐미 우리의 피부 표면을 조금 더 잡아당기면서 밀착을 해서 이 핸드피스가 움직일 수 있게 조금 더 붙어서 표면에서 글라이딩 할 수 있게 해주는 장점이 있습니다. 제가 조금 이따가 사진을 보면서 말씀을 드릴 건데요. 이런 울트라웨이브를 제가 초기에 사용을 했을 때 아무래도 폴싱 모드가 있지만 동양인 체형에는 상대적으로 큰 이런 핸드피스의 무빙에 있어서 좀 어려움이 있기도 하고 열이 빨리 오를 때 좀 불편감을 느낄 수도 있었는데요. 특히나 이것이 표면에 좀 핸드피스가 떠서 이동을 할 때 이런 현상이 많이 발생을 하는데 이런 백큐으로 조금 더 밀착을 해서 글라이딩을 할 수 있게 되면서 이런 부분들이 기술적으로 많이 향상이 되었습니다. 실제로 이제 시술하는 모습을 잠깐 보여드릴 건데요. 지금 따다다 하면서 폴싱 모드가 돌아가는 소리가 나고 있고요. 지금 받고 있는 분은 저희의 이런 비만 클리닉에 내원하시는 분들 중에서 뭐 지방이 뭐 좀 많은 편에 속하는 체형이신데요. 그래도 불구하고 전반적으로 우리가 이 핸드피스가 움직이면서 시술할 수 있는 영역이 상당히 작은 편입니다. 이런 게 아시아인들의 특성인데요. 그래서 무빙할 수 있는 공간이 많지 않기 때문에 조금 더 작은 영역을 움직이다 보면은 아무래도 열이 좀 빨리 오르거나 좀 불편감을 호소하실 수가 있는데요. 이럴 때 조금 더 밀착을 잘 해서 이제 시술을 할 수 있게 된 것이 이런 울트라웨이브의 좀 장점이라고 볼 수 있습니다. 제가 울트라웨이브를 사용하면서 느낀 것은 다른 장비들은 주로 하복부 쪽에만 이제 시술 효과가 주로 많았는데 이것은 전체적으로 폴싱 모드, 그다음에 리폴라이시스, 서큘레이션 여러 가지 기능을 함께 탑재를 하고 있어서인지 이 배꼽 주변의 중간과 윗배까지 좀 사이즈가 좀 빠르게 감소하는 특성이 있었습니다. 파란색으로 그리고 초록색으로 사이즈 감소한 걸 확인할 수 있고요. 남성분인데요. 이분도 역시 파워가 그렇게 높진 않고 최근에는 더 높여서 하고 있는데 초기였기 때문에 제가 에너지 레벨을 좀 낮게 한 상태에서 폴싱 모드를 이제 10Hz로 보고 이제 진행을 했습니다. 4회를 했는데요. 역시 하복부뿐 아니라 늘어진 부분도 많이 없어졌고요. 특히 이 상복부가 많이 감소하면서 거의 복근 라인까지 잘 생긴 것을 확인할 수 있습니다. 역시 사이즈 감소 확인할 수 있고요. 남성분인데요. 이 경우엔 제가 여러 가지 시도를 하기 위해서 조금 더 앰플리피케이션이 된 울트라사운드의 기능과 이제 폴싱 모드가 있으니 전체의 시술 시간을 더 짧게 해도 효과가 있을 수 있지 않을까 해서 시술 시간을 좀 줄여본 케이스입니다. 역시 파워가 그렇게 높지 않았고 시술 시간이 한 12분 정도였는데도 4회 후에도 전반적으로 이제 윗배부터 중간배, 아랫배까지 사이즈가 잘 감소한 것을 확인할 수 있었습니다. 이제 자신감이 더 붙어서 이제 시술이 조금 더 숙련이 됐고 특히나 이런 백큐ම් 이런 기능을 잘 사용을 하게 되면서 보시는 것처럼 지방량이 많지 않은 여성인데도 레벨을 더 높였고요. 20분 정도 안정적으로 시술을 진행을 하였습니다. 이렇게 해서 4번 정도 세션을 한 후에 전체적인 상복부, 중간 복부 그리고 하복부뿐 아니라 이 옆구리 라인까지 전체적으로 사이즈가 많이 감소한 것 역시 확인할 수 있었습니다. 이렇게 지방량이 적은 상대적으로 정말 얇은 이런 스키니한 분도 안정적으로 부작용 없이 시술을 할 수 있었다는 것이 저에게는 중요한 포인트였습니다. 종합을 했을 때 이런 울트라웨이브와 미니웨이브가 탑재된 이 프라임X에 대한 이제 저의 의견을 좀 말씀드리려고 합니다. 우선 이 폴싱 모드 그리고 백큐 모드 등이 추가가 되고 그에 비해서 효과가 증가되면서 환자분이 시술을 받을 때 조금 더 편안하게 받게 된다라는 장점이 있고요. 특히 좀 더 열감을 크게 느끼지 않으면서도 표면에 밀착이 잘 되기 때문에 넓은 부위나 조금 더 작은 국소 부위까지 좀 다양한 타입의 다양한 부위에 이런 인디케이션을 가리지 않고 모두 들어갈 수 있다라는 장점이 있습니다. 그리고 최근에 이제 증가하고 있는 지방 감소뿐 아니라 셀룰라이트 감소, 순환 증가, 타이트닝까지 한 가지 핸드피스 또는 한 가지 장비로 이룰 수 있다는 것이 일단 가장 큰 장점이라고 할 수 있습니다. 제가 주로 요즘에 보는 환자분들은 이전에는 뭐 팔도 가장 늘어진 부분이 이런 조금 더 프록시말한 에어리어였는데 최근에는 좀 디스탈 쪽, 즉 팔꿈치 바로 윗부분에 이런 지방 감소나 탄력을 원하는 분들 또는 무릎 바로 위쪽, 즉 뭐 샤넬 라인, 즉 허벅지와 무릎의 안쪽 이렇게 좀 작거나 국소적이거나 정말 본인만 고민하고 있는 섬세한 부위에 대한 고민이 많아지고 있는데요. 기존에 있던 이제 논 셀렉티브한 하이프로는 이런 너브 데미지라든지 이런 문제 때문에 이런 국소 부위에 적용하기는 좀 어려웠는데 셀렉티브한 울트라사운드 그리고 조금 더 편안하고 이런 초음파의 이런 효과는 조금 더 증폭된 이런 울트라웨이브나 미니웨이브를 사용하게 되면서 이런 전반적인 들어갈 수 없는 범위가 거의 없어졌다. 즉 거의 모든 부위의 고민을 해결할 수 있다라는 것이 최근에 제가 많이 사용하고 있는 바디 시술의 새로운 트렌드가 되었습니다. 결론적으로 우리 바디 영역, 이런 에스테틱 메디슨에서 원하는 이 4가지 인디케이션을 한 번에 충족시켜 줄 수 있다라는 것이 가장 큰 장점이라고 말씀을 드리는데요. 마지막으로 여러분들과 함께 논의하고 싶은 것은 바로 이런 프로토콜의 정립인데요. 사실 이 프로토콜은 비교적 안전한 범위 내에서 이제 각 클리닉의 각 의사분들의 이제 필요도에 따라서 여러 가지 베리에이션이 가능합니다. 제가 사용을 해본 결과 울트라웨이브나 미니웨이브는 더 파워 레벨을 더 높게 진행할 수가 있고 상대적으로는 통증이나 뜨거움을 덜 느끼기 때문에 시술 시간을 늘려도 비교적 편안하게 받을 수 있다라는 장점이 있습니다. 그래서 제가 시술 시간을 줄여봤을 때 기존의 시술 시간, 다른 핸드피스를 사용했을 때와 동등한 거의 효과를 봤는데요. 그러면 반대로 더 짧은 시술 시간이 가능한 장비로 활용할 수도 있겠고요. 또는 기존의 핸드피스와 같은 시간 또는 오히려 시술을 더 늘려서 편안하게 받을 수 있기 때문에 효과를 더 극대화할 수 있는 이런 프로그램으로 운영할 수도 있을 것 같습니다. 아마 이런 부분은 말씀드린 것처럼 각각의 요구도에 따라 다양하고요. 비교적 많이 사용을 하면 할수록 부작용이 거의 적기 때문에 좀 더 다양한 응용이 가능할 것으로 보입니다. 제가 아시아 최초로 이 울트라웨이브 미니웨이브의 기능이 탑재된 프라임X를 사용을 하면서 여러 가지 경험을 쌓을 기회를 가졌는데요. 제가 오늘 말씀드린 여러 가지 노하우나 이런 프로토콜에 대한 고민들을 앞으로 함께 경험을 하면서 나눌 수 있는 기회가 또 생겼으면 좋겠습니다. 감사합니다.
Thank you so much, Dr. Ko. And just a quick apology, Dr. Ko is not only a professional at aesthetics, but she's also a family doctor. So thank you for your expertise and experience. We have a few questions coming in. And if you have any further questions, this is the time to now please submit them in the chat box and we will hopefully get to all of them. I'd like to welcome all 3 doctors, Dr. Ko, Dr. Rudialis, and Dr. Werner. If you can, please unmute yourselves. And we have some questions coming in. I'll start off with the first question for you, Dr. Ko. Have you seen that these treatments are effective and able to do for men as well as women?
Oh, yes, absolutely. Can you hear me?
Yes, I hear you very well.
Yes, it works well to men because its effect is good for upper abdomen as well as the area near the navel. So we have many good results of men's abdomen. Men has obese upper abdomen usually.
Yes, I agree. Yeah, we actually saw it here as well, and Dr. Werner and Dr. Rudialis also worked with both men and women, and we did see very good results, as you said. Dr. Werner, a question for you. From all your experience and all the patients that you did, are you planning on writing or publishing a clinical paper?
Well, we actually have published a clinical paper. As you know, it has been published recently in dermatologic therapy. We had 18 patients and we had really, really great results. Actually, we had a 5.2 centimeter circumference reduction even after 3 months. So the interesting parts were that we had actually quite fast results. So already after 4 treatments, 1 week after, we had really great results. And also we had very good long-term results. So these results actually stayed 3 months after. So yes, we will be able to publish another paper because we are collecting more data. But I think this is a really nice publication. I think that you could maybe ask it so that it's sent to you. How we did the study, we actually used the classic protocol, the protocol that uses only the ultrawave transducer and handpiece, and that was actually very, very interesting to see such great, amazing results. And I suppose that with the other 2 protocols, the results may even be much better because we have seen some patients who have had 8 centimeters and 7 centimeters. So circumference reduction, and also some more tissue tightening after the combined protocols.
Yeah, I agree. We saw amazing results just with the ultrawaves. If you add the additional RF treatments to that, we expect to see even better results. Dr. Urdialis, a question for you that came in. When you treat, do you treat the entire abdomen? Like, so do you treat the flanks as well in the same day, or do you divide it into different sessions?
We are treating the same, all the treatment at the same day. Only for the study was radiofrequency and ultrasounds in the abdominal area and only ultrasounds in the hips area. But actually, we are doing much more than 4 sessions. We are doing between 8 to 10 sessions, and the result will be amazing, much better than I presented before. And always we combine ultrasounds and radiofrequency, always in all the patients. The main difference between this technology and the technology that we had before about Accent Prime only, it's the energy of the ultrasound, because in my opinion, the radio frequency is the same, but the action of the ultrasound is much better, and it's possible to apply in any other treatments, like for example, cellulitis, that we did before with other devices. I think that the new platform is possible to apply in much more pathologies, not only the local obesity, is possible to use at the cellulitis treatments as well. And the management of the ultrasound device is better, is much more safety than before, and the results are much better than before.
And so another question that we have, thank you for that. Another question that we have, and I'm not sure if which doctor has experience with this, but can you combine it with other, like, can you combine the ultrawave or the RF treatments with other platforms? For example, one of the questions says cool or laser sculpture or other platforms, energy-based devices. Can you apply the the Alma PrimeX in combination with other treatments?
We have done the treatment in patients, for example, who did a laser liposuction before, and they don't obtain a very good skin tightening in the area. For this reason, we use ultrasounds and we use radiofrequency, for example, in the abdominal area and in the hips area and in the arms area as well. And we feel that the tissue was much more tightened, and we obtain images with the ecography that you are producing much more collagen in the area. In my opinion, about the cool sculpting, I don't have experience with cool sculpting, because for me, I don't have experience for that. But we have a lot of experience with lipo laser treatment, and now when we don't obtain results in the skin tightening in the areas with the lipo laser, we continue the treatment with the radiofrequency and the ultrasound of this device.
Thank you. A question for Dr. Ko that came in earlier. What would you see as the best indication to treat with the Alma PrimeX in the Asian market and in general?
Yes, it's good for the large area or very small and delicate local area. It's good for both of them. But in these days, it works well to upper abdomen. I already told you. Other device was good for lower abdomen or sagging, but PrimeX is good for lower abdomen and upper abdomen. So I use it the whole abdomen. It's very good.
So you've seen great results with the abdomen in general. Thank you. And Dr. Werner, question for you. What do you see as the best benefit with the ultrawave applicator from your experience? I guess in terms of the features and the results.
Yeah, so the best benefits are, first of all, that it's effective, but also it's very easy to use. As I said, it was very comfortable in the use, and the treatment is quite short. So we've been doing these 20 minutes treatments, which were, you know, so convenient for the patients. So it's the efficacy, the convenience, the ease of use, and really I think the new features that are there, like the vacuum and this cone-shaped applicator and all these, and the pulsed waves, all these new features actually really made a difference with the previous applicator. I think it's a really great improvement, and patients actually, maybe one of the best things is that the patients really like it because they saw results, they had a pleasant treatment, it was easy. So yeah, I think it's a great applicator. It's really great.
Yeah, I agree. It's easy to use and the treatments are nice and comfortable and the results are amazing. So altogether it's a win.
Yeah, altogether it's a win.
It's a win.
Exactly, yeah.
We have a few more questions. I'm not sure we'll be able to answer them all. One question for you, Dr. Ordiales, in terms of the number of sessions that you do, I assume this varies, but how many sessions would you do normally? And do you think there is a need for maintenance sessions? And if so, when? How often?
Okay, then now actually we are doing normally 8 sessions. The first 4 or 5 sessions we're doing weekly, and the rest of the sessions we are doing in 1 month more or less, because we feel that the results that we obtain are much more quickly than before, than the device that we had, that this is Accent Prime that we had before. So totally of the treatment we are doing from 8 to 10 at this, with this timing actually. We obtain the better results in the patients and a huge and dramatic change in the first 4 or 5 sessions. Then the rest of the sessions is doing for to finish the treatment until 8 sessions more or less. About the maintenance treatment, now we are doing from 3 to 4 sessions in a year when the patients are finishing the treatment. We are always doing radiofrequency and ultrasound treatment. Obviously, we can select with the phase shifter the deeper of the radiofrequency that we would like to apply. Is different, for example, in arms or in internal tight than the radiofrequency that you are using, for example, in abdominal area or in the back or in the thighs, for example.
And you feel that the maintenance sessions help maintain their effect or prolong the effect?
Yes, we feel with this technology always a big result in the first 4 sessions. In the first 4 sessions that we did before, between 15 days, and with the study we did weekly sessions. So I am totally agree with the doctor that talks about the action of the ultrasounds. And I think that this kind of technology must be used in a body sculpturing unit. You know, a body sculpturing unit is a body sculpturing area of your clinic that you have a dietitian and you have devices and you have, and it's necessary to combine, because for the study we try to not choose people who are in obesity or people who have obesity, because I think that the obesity is the enemy of the aesthetic medicine, and you never obtain a very good results in nothing, in fillers, in lipo, in nothing in the people who are obese. So if someone comes to the clinic to reduce the body contour and they are obese, it's necessary to reduce in the weight, and at the same time it's necessary to use this kind of technology that allows to reduce the obesity areas quicker than if the patient didn't do nothing.
Thank you. I completely agree with you on that. Few last questions. Have any of you tried to combine between the Alma PrimeX sessions with any slimming product?
Yes. I combined the lipolytic agent and the PrimeX Ultrawave, but the result was good and relatively safe. I inject the lipolytic agent. After that, I apply the PrimeX ultrasound. Ultrasound is not a radio frequency, so it's relatively safe than radio frequency. I do not use lipolytic agent and RF radio frequency, but I usually combine the ultrasound and lipolytic agent. We use lipolytic agent and with anesthetic agent, so patients feel more comfortable after injection.
And you've seen a good result between when you combine?
Absolutely. It's good for the circulation and washout.
Okay, makes sense. And one more question: have you experience with doing the ultrawave treatments after cryolipolysis?
I don't use cryolipolysis. No, I don't. We actually have this one, and actually I'm also using the injection lipolysis, and the combinations are great with the injections for local areas, and then to do more tightening and to get the ultrasound and the RF effect. It's amazing.
So you get the whole effect together. And one last question. So with these treatments, we obviously use oil for both the ultrawave and the RF. Have you experienced any redness after treatments or some rashes from the treatment? Is this something that you've seen? And if so, how have you dealt with it?
Yes.
I think
Sometimes...
Sorry.
Okay. All right. It's okay.
Go ahead, Dr. Ordiales, and we'll end up with Dr. Koh. Dr. Ordiales?
Oh, I'm sorry. I'm thinking about that. Redness is necessary in our treatment because it indicates that the final of the applying of the energy in the areas, and we are talking about radio frequency, and we are talking about ultrasounds as well. So the end point is necessary to calculate with your strategy and with your experience when you see the color of the redness. We must be nearby the final cut. Okay.
Thank you. And Dr. Koh, have you had any experience with redness or rashes on the skin?
Yes. At first, I used more expensive oil with aroma, but it's not good. Yes. Recently, I use only pure oil, like mineral oil. Yes. So the rash or the redness was decreased after that. So we use only pure oil, and Asian people have the more weak skin. And
Sensitive.
so, yes, it's very sensitive. So we can do test the heat rising temperature. Yes, and pure oil and vacuum assistance, the contact is very more important.
Yeah, contact, and especially the vacuum helps also with the
Yeah.
contact. The new vacuum feature also helps with that.
Yes, it's good.
Yeah. Okay, well, I think we've tried to answer all the questions. If any of our viewers have any further questions, please feel free to ask us directly, and we can always forward them on to our wonderful KOLs and doctors that have been with us. Thank you very, very much to all of you for joining us, and a very, very special and big thank you to Dr. Ko, Dr. Urialis, and Dr. Werner. It's been so wonderful to work with you on this project. We've learned so much from you, and we hope to do many, many more projects with you in the future. So thank you very, very, very much, and hope to see you all soon.
Thank you. It was a pleasure. Thank you so much.
Thank you.
Thank you.
Thank you so much. See you soon. Bye-bye.
See you soon. Bye.
Bye.
Bye-bye. See you soon.
Bye-bye.